Today we're going to do a sterile central line dressing change. First, I'm going to start by verifying my order and reviewing my plan of care. Then I'm going to identify my patient, gather my necessary supplies and equipment, explain the procedure, perform hand hygiene, and provide for privacy. I'm going to have the patient up to a comfortable working level, and I'm going to elevate the head of the bed and lower the side rail. I'm going to place my mask on my patient and tell my patient to take their head and turn it away from the dressing line. And then I'm going to set up my sterile fill. I'm going to start by putting on my mask and putting on a clean pair of gloves to remove the dressing. I'm going to look at the kind of devices inserted into the patient, and then I'm going to check the site for patency, placement, skin integrity, and the drainage. Then with my non-dominant hand, I'm going to hold this, and then I'm going to remove the old dressing. If this wasn't coming off easy, I would use some saline solution. I'll start from the outside. And work my way in. And I would remove the discarded gloves and soil dressing. Then I would perform hand hygiene. And then I would place on my sterile gloves. Then I would stabilize the catheter with my non-dominant hand, taking the alcohol swab right there. And then I would start by cleaning from clean to dirty, switch sides. And then I would discard. Then I would take my Chloraseptic and I would start cleaning back and forth vigorously for about 30 seconds. And then also, I would also clean the hubs and extensions with the swab at this time. Dispose of this in the proper container. And then I would allow for the site to completely dry. And I would place a sterile dressing change. Making sure that's completely smooth. If it wasn't, I would redo it. Also, this hand would not be touching the patient. Then once that, I would time, date, and initial and place it on here. And then I would move the supplies and throw them away. Position my patient with the side rails up, put them down into a comfortable position, lay them back down, remove their mask, and then I would remove all of my PPE, wash my hands, and document the procedure.